This is the ProWorks Gear Line 1 Medical Fanny Pack, and I'm going to run through what we have in it and why today, in layman's terms. First up is compressed gauze and combat gauze. Combat gauze has stuff on it to help any bleeding. Then down here we have trauma shears to cut off clothes or bandages, and then a tourniquet to stop bleeding on legs and arms that's severe, and then tape to help secure any items to a person if needed. When we open it up, we have these neat elastic bands, and I'm going to start over here with our needle decompressions, and that helps you use them in case there's any chest trauma. And then we have an EpiPen for allergic reactions or any other epinephrine needs. We have more gauze, and then down here we have ACE wrap and combat gauze. Of course, ACE wrap is to keep things in or on. Then we have our Crike kit as an alternate airway. We have our IV band, and then the Benadryl itch stick for basic bug bites or itchy needs. We have our gloves over here for PPE if we need. We have a pressure bandage typically used for gunshot wounds. Then we have an inhaler for, of course, any sort of asthma patients and such. We have our pulse ox to keep track of heart rate and oxygen. Behind, we have tucked an IV start kit. And then we have a thermal blanket if a patient goes into shock and you need to warm them up or anything like that. We have more IV start kit stuff. We have nasal airways for an alternate airway. We have chest seals, again for chest trauma if needed. Then we have basic band-aids, and then more Crike kit parts that needed to be hid back here in this pocket. That is essentially our Line 1 Medical Fanny Pack.